Welcome to Uganda, a nation brimming with resilience, hope, and untapped potential, where a path of transformation is being carved out and supported by the unwavering commitment of Pathfinder International. With a rapidly growing population and a high fertility rate of 5.2 children per woman, Uganda's population faces multiple health challenges. Therefore, ensuring access to comprehensive family planning services and healthcare is vital. However, social norms, limited resources, and lack of knowledge hinder the uptake of family planning, leading to unintended pregnancies. Pathfinder is working to address these barriers through the USAID Family Planning Activity (FPA) in 11 districts in Uganda.
Pathfinder is implementing USAID's flagship family planning program. It is called the USAID Uganda Family Planning Activity. The goal of this project is to increase the adoption of healthy or positive reproductive health behaviors among women, men, and young people.
In this activity, Pathfinder Uganda is working with 3 core partners, with each playing a key role.
We work with other organizations like the Uganda Protestant Medical Bureau, Samasha Medical Foundation, and the Uganda Youth and Adolescent Health Forum. So these support things like supply chain, youth programming, and even clinical empowerment of health workers. In this project, we operate in a total of 11 districts. So selection of these districts followed a study that USAID conducted. It was called the Fertility Hotspot Study that kind of ranked districts in Uganda depending on the rate of teenage pregnancy. So these districts not only came on top, but also did not have services to prevent teenage pregnancies.
Our work through structures begins at that high level where we support National Planning Authority, Human Capital Development Program, and working across diverse sectors that include health on one hand as the primary health service sector.
In addition to this, we have built capacity of cultural and religious leaders to be able to advocate for family planning, financing, as well as activity integration at the national and the district level. We have also built capacity of the political teams under the political caucus engagement.
The political caucuses have ensured that money be allocated or funds be allocated to family planning. And we've achieved this in 10 districts out of 11 focus districts.
We have been able to support the district's health management teams to strengthen HMIS reporting across all the 11 districts that we are supporting as an activity by basically monitoring the health facility reporting patterns, but also being able to quantify and redistribute FP registers that are used.
Among the IPC skills, we are having the Young Emanzi dialogues, and it's basically addressing, it reaches out to adolescent boys and young men, particularly for purposes of, young boys have kind of been left out and they have a lot of SRHR challenges. So we felt that it's very important for us to reach out to them, one, to help them understand their sexual reproductive health needs, but also be able to know how do I address my SRHR needs.
We have set out to do quite a number of interventions, and these interventions have been informed by the baseline assessment and the data quality assessment during the inception of the project. A lot of information and gaps were identified around the health workers' capacity to provide long-term family planning services. We do assess the skills of the health workers as we start the mentorships, but also as we complete the mentorship, we assess to ensure that the mentee has acquired the desired skills.
One of the interventions we've rolled out in the FPA program is around strengthening the community supply chain to enable distribution of contraceptives through community health workers and outreaches. And this is one of the high impact practices for family planning.
A key component to the success of the USAID family planning activity is its partnership with the government of Uganda and its agencies. Working hand in hand, the two bodies have been able to drive the adoption of positive reproductive health behaviors and contribute to long-term shifts in Uganda's modern contraceptive prevalence and fertility rate.
Family planning activity has played a big role in revitalizing the country's focus on addressing social norms to increase uptake of family planning, addressed the leadership and governance issues, as well as improving service delivery.
The family planning activity has built capacity of all our health workers, and they are able to provide safe family planning services to all our community members.
There was a knowledge gap amongst midwives and also other service providers. But when the Uganda family planning activity came in, everyone was reached with the knowledge of family planning, and they are able to give service wherever they are.
When you undergo this training, you get knowledge. You get how it is valuable to provide family planning services to youth. We have knowledge on how to provide all the services, and you have to be friendly.
What exactly was trained on about family planning, the methods of family planning, and how to give method to someone or to a client, majorly short-term method. So the people in my community, they are no longer moving a distance to go and look for methods of family planning. They are picking it from here.
USAID family planning activity also engages cultural and religious leaders in promoting positive reproductive health behavior.
The issue of religious people embracing family planning was a bit hard, because religious people, including me, I knew that family planning equals to abortion. But after the training, then we were able to understand exactly what is family planning, and we were able to help others also to understand it.
Bwe batutwala mu kusoma era nali nkalubye, naye bwe twagenda okusoma ne bambuulira nti kiba kirungi okuzaala omwana n'obaako enteekateeka gy'okola ki gy'omuteekerateekera, era ne tuteesa waakiri omwana tumuzeeko kitole nnyo waakiri emyaka eno oba emeka oba etaano.
In the district of Chenjojo in western Uganda, Sharon Ayebale became pregnant at age 14. Sharon had aspirations of becoming a doctor, but her life took an unforeseen turn when she conceived. Her story resonates with the countless challenges young girls and women face in low and middle-income countries, where many lack access to comprehensive information on family planning. The USAID family planning activity has equipped Sharon and many other young people with the skills to advocate for positive reproductive health behavior in their communities.
Before I got pregnant, I had my dreams of becoming a doctor, and I really wanted to be a doctor. So when I got pregnant, I saw my dreams that will not come true. I saw the pregnancy, and I thought that the future will end from that pregnancy. But when I heard about family planning, I can say the future is coming back. So I use my story to tell these young girls I see. For example, for them, they know me, they saw me when I was pregnant. So when I told them, they believe in me. They see what happened to me the other time, and they see now where I am. So I use my story to tell them that, you see, when you get pregnant, life does not end there. When you use family planning, you continue with your school, and you continue with everything, and the dreams will come true.
The recognition of gender as a fundamental aspect of family planning has ushered in a new era of interventions that seek to address the specific challenges faced by women and men in Uganda. It underscores the importance of equipping women to make informed choices about their reproductive health and granting them autonomy over their bodies. Equally, it seeks to engage men as users, partners, and agents of change, acknowledging their role in fostering supportive environments for family planning and promoting gender equity.
FPA is committed to integrating gender throughout the project life cycle because gender is a social determinant of health outcomes.
In hard-to-reach areas like Chibale, Bulisa, Rakai, and Bundibujo districts in western Uganda, communities struggle to access quality health services due to poor road networks and difficult terrain.
Abaami eno tuyinayo enkola eringa eddiini etakkiriza nnyo mu byabulamu ebya family planning kugemesa kukola ki nti bo baate babikkiriza nti Bayibuli ebagamba bazaale bakole ki baale ebyokusibamu tebakola ki tebabyagala tuzaale Katonda yanaaba abalabirira naye bwe tugenze twogeramuko nabo waliwo enkyukakyuka.
Pathfinder, through the USAID Family Planning Activity and its Female Condom Project, FC2, has extended family planning services to members of the fishing community in Bulisa district.
We've done this looking at specific communities or populations. We focus the fisher folks, that is the landing sites, especially in the Alberta in the Rift, but also look at risk populations. How do you give the protection to ensure that these populations that are at high risk sexual practice risks are protected from the three issues: HIV, STIs, and the unintended pregnancies.
With more than 250 maternal deaths averted, over 158,000 unplanned pregnancies averted, and $11,220,735 of direct healthcare costs saved, USAID FPA has made a significant impact in all its districts of operation. Pathfinder is paving the way for a healthier and more sustainable future through the collective efforts of committed individuals at every level. Uganda is embarking on a transformative path. By averting unintended pregnancies, Uganda will reap health and economic benefits. We invite you to join hands with Pathfinder to work towards achieving our mission. By partnering with us, you can make a tangible difference in the lives of countless individuals and communities across Uganda. Together, we can ensure a path forward for all.